There is quite a bit to know about epilepsy drugs, and we're not going to cover it all in this lecture, so please spend some time with this chart. The chart discusses the main anti-epileptics, and it's organized by which types of seizures they treat. We can break this chart down into chunks to work on. For instance, first, remember which drugs treat partial, and then which treat generalized seizures. Then go back and work on the mechanism of action, and later on we'll talk about the side effects. This is really important information for the Step 1 exam. One way to memorize the mechanism of action is to think about excitability and inhibition. Seizures, as you recall, are a hyper-excitable state, so treatment is aimed at increasing inhibition. The voltage-gated sodium channel blockers are one class of anti-epileptic drugs. They prolong the inactivated state of the sodium channel, so the refractory period is prolonged, and the neuronal firing rate is decreased. Now, what is the main CNS inhibitory neurotransmitter? That's right, it's GABA. So a lot of the drugs act to enhance GABA transmission and inhibit glutamate excitation. These would include drugs such as topiramate, phenobarbital, valproic acid, benzodiazepines, tiagabine, and vigabatrin. Lots of drugs acting on GABA. Absence seizures are caused by thalamic relay neurons activating a certain type of calcium channel, leading to hyperpolarization that again is mediated by GABA. Thus, ethosuximide, which blocks the low voltage-gated T-type calcium channels, is used as first-line treatment for absence seizures. For partial seizures, carbamazepine and phenytoin are most commonly the first-line treatments. Lamotrigine is effective against both partial and generalized seizures, and may have fewer side effects than carbamazepine or phenytoin. Valproic acid is usually prescribed for tonic-clonic, also known as grand mal seizures, but has a very broad spectrum and can also be used to treat partial, complex, and absence seizures. The benzodiazepines, like diazepam or lorazepam, are not used for day-to-day treatment of epilepsy, but rather for emergency situations such as status epilepticus. The goal for treatment there is to break the seizures as fast as possible. Levetiracetam, also known as Keppra, is commonly used in neurology these days because it is effective at treating both partial and generalized seizures. Also, compared to other anti-epileptics, it has a low side effect profile. You'll notice here that the mechanism of action is unknown. The anti-epileptic drugs have many side effects. The most serious ones to look out for are bone marrow suppression and fulminant hepatitis. Now, let's say you see a child who was started on lamotrigine 2 weeks earlier and is now coming in with a widespread rash. What are you thinking about? That's right, perhaps the child has Stevens-Johnson syndrome. Now, benzos we're going to talk about soon, but generally think about CNS sedation leading to respiratory arrest and coma. Carbamazepine is a drug that often causes hematologic disorders, such as leukopenia or thrombocytopenia. Aplastic anemia is also infrequently associated with carbamazepine. One way you might remember this is that with carbamazepine, you want to check a CBC. Carbamazepine, along with some other drugs, is known to induce the cytochrome P450 system, which is responsible for its own metabolism. Ethosuximide primarily causes nausea and vomiting, lethargy, and headache. Phenobarbital, like the benzos, is a CNS depressant, so it can cause sedation. Valproic acid can produce nausea or vomiting and also lethargy. While using it, it's common to see an elevation of liver enzymes. Rarely, it can cause a fatal hepatitis. Two uncommon dose-related side effects are thrombocytopenia and clotting disorders. Valproic acid is also associated with cosmetic changes including weight gain and alopecia, so people tend not to like the drug. And as if all that wasn't enough, this drug is also teratogenic. Phenytoin is a drug that is used all the time, very important in epilepsy and seizures in general, so we'd like to talk about it in a little more detail. Generally speaking, phenytoin is a safe drug. It's an older drug, and many side effects have been discovered. It can cause dose-related ataxia and nystagmus. It has been implicated in causing a lupus-like syndrome. It can cause certain cosmetic side effects, including hirsutism and gingival hyperplasia. Osteomalacia and a hepatitis syndrome may occur, and phenytoin is also teratogenic. Barbiturates are a class of drug that act at the GABA receptor and are CNS sedating drugs, so they're used as anxiolytics, antiepileptics, and hypnotics. The GABA receptor is an ion channel. When GABA binds, chloride enters the cell and causes hyperpolarization, leading to decreased excitability. Barbiturates bind at a site on the GABA receptor that keeps the chloride channel open for longer periods of time, so it affects the duration. Benzodiazepines, which we'll discuss next, bind at a site on the GABA receptor that changes the conformation such that the frequency of chloride channel opening is increased. So barbiturates affect the duration, benzos affect the frequency. Barbiturates have the potential for addiction as well as dangerous overdoses, so their use has largely been supplanted by the benzodiazepines. And what's the most dangerous side effect of barbiturates? Well, respiratory depression, which can lead to death. The only one that is still used with regularity in medicine is thiopental, which is given to induce anesthesia before surgery. Here's another high-yield, highly tested neurology topic, and one that will come up all the time on the wards. Benzodiazepines act at the GABA-A receptor, as we just described. Because they cause CNS depression, they're used for a wide variety of diseases. Anxiety is managed primarily by alprazolam, known as Xanax, lorazepam, better known as Ativan, and clonazepam, which is Klonopin. These drugs are usually used temporarily for acute anxiety. Chronic use is not recommended because of their abuse potential. Because of their sedating effects, these drugs can also be used to treat insomnia. Benzodiazepines decrease the time it takes to fall asleep and also increase the amount of stage 2 sleep, but it comes at the cost of decreasing REM and stage 4 sleep. When benzodiazepines are discontinued after a longer period of use, rebound REM sleep can occur, characterized by bizarre dreams. It's important to know that benzodiazepines are first-line therapy for status epilepticus. They're commonly used as well in the treatment of alcohol withdrawal. The most commonly used of these are chlordiazepoxide, which is Librium, lorazepam, and diazepam, better known as Valium. They're used to manage anxiety, autonomic instability, and seizures in the acute period following alcohol withdrawal. In patients who are extremely nervous about an upcoming surgery, benzodiazepines can be given to pre-medicate before induction of anesthesia. They can also be used to maintain patients in the so-called twilight zone during procedures that do not require anesthesia, such as endoscopy. The side effects of these drugs include sedation and lethargy. They're safer than barbiturates because of the reduced likelihood of respiratory depression. Flumazenil is a competitive antagonist of the GABA receptor, and it can be used to reverse the effect of a benzodiazepine overdose. Benzos do produce physical dependence, and they have a high abuse potential. Withdrawal symptoms are more likely in short-acting benzos, such as triazolam and alprazolam. The most common symptoms include autonomic instability leading to tachycardia, diaphoresis, and also hypertension. Patients may experience tremor, GI upset, or muscle twitching. When benzos are discontinued, patients may experience rebound symptoms with anxiety and insomnia that are even worse than before they started drug treatment. We'll mention some non-benzodiazepine hypnotics. These are agonists at the benzodiazepine site on the GABA receptor, but chemically they are unrelated to the benzodiazepines. They're usually used to treat insomnia, so you'll recognize drugs such as zolpidem, which is Ambien. These do not have the anxiolytic, anticonvulsant, or muscle relaxant effects that the benzodiazepines carry. They do not affect REM sleep. They have a short duration of action, so they're thought to cause less confusion and somnolence upon waking. And these drugs have a lower abuse potential because patients develop GI upset when high doses are taken.